How we doing? This is Cam, and I'm gonna do scenario one for you guys right now. So our patient is Sally. Sally works in an office every day, sitting in a chair. On the weekends, she's a gardener. She was pulling some weeds, so I'll demonstrate kind of. She's on her knees. I'm not sure. She's pulling weeds. Tweaked her right lower back, so we see that that was a strain. So for the first couple of days, immediately after the injury, we want to just kind of make sure she's relaxing, making sure she's not doing too much twisting and stuff, affecting that injured area, and but making sure that we are keeping the other adjacent muscles activated, so that way she's not getting stiff and stuff at work. Making sure she's sitting with proper posture. We don't want her leaned over like this, putting stress on the back. We don't want her like super flexed and extended in her trunk with her spine and stuff. We want her just at a moderate kind of neutral position, making sure that the back is like in a good stable position. The next phase we're going to go into, we're going to do some stretches that I kind of think are great for just kind of warming up Sally's back coming straight off of the injury. First, we're going to go into just regular hangs. I mean, I do these before warming up for anything, just to kind of strengthen and like start warming up the back. So we're gonna go down into just a hang here, depending on where she feels the pull or the pain in her back. She can stop here. If she can go farther down, she can go farther down. And we're gonna just go and we're gonna do that a couple times, slowly just feeling that, the pull in her back and that stretch. And so then once we do that a couple times, seeing how she's feeling, because we know it's specific on her right side, we're gonna next go into some hangs with rotation. So we can come here and rotate as far as she can go comfortably. We don't want her stressing too much. And then we can come to the other side and twist and twist. And like I said, just go until however she feels comfortable. And then the next stretch we're gonna do is the cobra. So we're gonna come here, one of my favorite yoga positions, and we're gonna come and press up, extending the back, taking deep breaths, getting a good stretch. And those are some of the stretches. The next thing we're gonna do, once she moves on in her rehabilitation of her lower right back injury. Imagine these are some dumbbells, not too heavy. We're not trying to go crazy here, just trying to warm the back up. We're gonna do some just lightweight dumbbell deadlifts to get the back just kind of activated using some weights and stuff. And then a personal, one of my favorites, a cross body stretch. So if this was like a 5-10 pound dumbbell, because we know that she did it and she's an avid gardener and she's gonna wanna continue gardening. She's gonna be on her knees pulling weeds and stuff. We're gonna do crossbody pulls. So if this was a dumbbell, we could start the dumbbell here. Sally's gonna start here. She's gonna twist and pull the dumbbell across. And then same thing here, twist and pulling the dumbbell across. Twisting, feeling the right lower back here, kind of extending, reaching out and pulling here. This is a great exercise to make sure that Sally doesn't re-injure that lower affected area in her back, and she strengthens it so that way she's able to get back to her everyday life. That's scenario one. Thank you. What's up? This is Cam, back at you guys with scenario two. This time the patient is Jane. She's a college student just like myself, playing on the volleyball team. She has developed facet syndrome. How are you doing, brother? One of my residents just walked in. He's watching me do scenarios here. So we have Jane, yeah, like I said, college student. She has developed facet syndrome. She's a setter. So like our last scenario, we're gonna start with some stretching. So personally for facet syndrome, we're gonna get down on our backs here. We're gonna do some single leg knee tugs or knee pulls. You can either put your hands over the knee or underneath with some bend in your left leg or not. And we're gonna slowly pull our knee back here like this, taking a deep breath, feeling wherever Jane feels comfortable. We're gonna switch, do the same thing on this side, and we're gonna relax and take a deep breath and pull, and we're gonna hold these for, obviously 10-15 seconds. And then the next thing we're gonna go into is a stretch I like to call just knee hangs, or knee falls, knee drops. I don't know, I've had coaches call them a couple of different things. So we're gonna be here, and we're gonna let our knees rotate and fall to one side. We're trying to keep our back flat down here, and twist to the other side here, getting a good stretch here in the back. And then, like I incorporated some yoga in the last scenario, we're gonna do some yoga here, and we're gonna go into a child's pose, one of the best stretches, I think, for your back. And so we're gonna come here, and we're gonna child's pose. Deep breath, feel the stretch in your facet joints in your back. Jane can do that a couple times. And then next, Jane, we're gonna go into some cross body movement. cross body movement work. And then so first we're gonna start with Supermans. So we're gonna go into Supermans here, and we're gonna hold, and here, and hold, and here, doing our Supermans holding. And then we're gonna get on our back here, and we're gonna do bridges. I like kind of pulsing bridges here. Instead of just going up and down quickly, we're gonna flatten our back here, and then come up and squeeze, and slowly drop down and flatten our back, feeling our joints in our back, slowly extending and releasing. And we're gonna do a couple of those. And then lastly, we're gonna finish up with just some stabilizing movements. Jane could start off, you know, if she wanted to. We can start here with just one arm extends like this, and then we can go to our one-legged, and eventually, as she feels better, as her back, you know, develops and we move all along in the rehab program, we can get to, you know, dual movements. So opposite leg, opposite arm, reaching and extending like this, you know, getting a good squeeze on your back here. I mean, even doing a couple of these, I feel it in my back. And so yes, that is the rehab program we have for Jane, our volleyball setter, hoping to get her to return to play here pretty quick.